Okay, get the recording going. Okay, great. Good morning, everybody. Welcome to today's COVID-19 conversation. It's been a week as far as these conversations go. Those of you who tuned in earlier this week will know we had a great conversation with a local banker and accountant to talk about the financial aspects of the current crisis and availability of federal resources and ways that you as a business need to account for those resources as you acquire them. But today we are very pleased to have with us a physician from OU Medicine, Dr. Batzler. And let me give you a little brief pieces of his bio. He is a professor and chair of the Department of Health Administration and Policy at the Hudson College of Public Health and a professor in the College of Medicine at the University of Oklahoma Health Science Center. He's a past member of the CDC Healthcare Infection Control Practices Advisory Committee and also a fellow of the Infectious Diseases Society of America, in addition to many other responsibilities and accolades. He and I agreed that I wasn't going to read his full bio, but it's very impressive. And we are thrilled to have Dr. Batzler with us this morning to share with us about steps that businesses need to take to safely reopen. We all know that the businesses have been given the authority to open. We want to do everything we can as a community to support our businesses, and we want to encourage them to get the economy cranked back up, but we want to do it in a safe way. So Doctor, thank you so much for being with us today. We greatly appreciate it. And I'm going to kind of kick it to you to share with us some of your thoughts.
All right, thank you. It's really an honor to be presenting to this forum this morning. I'm going to share a short slideshow that I just want to use to highlight some of the key scientific points about COVID-19 that I think we need to think about as we reopen, because I'm going to try to make the point that some of the things I'm going to show you do have some implications when we do reopening of the economy. So let me share my screen here. And Scott, if you'll let me know if you can see it.
Looks great. Yes, sir.
All right, thank you. All right, so I'm not going to spend too much time talking about COVID-19, the science of it, but there are a few points again that I want to make. This is a picture of the virus. Actually, the picture in the lower right is electron microscopy showing the virus in lung tissue. When the virus gets into humans and into lungs, it really replicates, and you can find lots of virus in the tissues. The pictogram of the virus shows the spike proteins. That's only important if you're interested in vaccine development, because a lot of the vaccines are working to generate antibodies against the spike protein. That spike protein is the protein that attaches to human cells. So that's my very brief biology lesson about coronavirus, the infection. You've all been exposed to coronavirus. I think that's really important for everybody to know. Coronaviruses are common. There are 4 that circulate in the human population that we actually sometimes test for when we're seeing patients who present with respiratory symptoms. They tend to occur more commonly in the winter, and they tend to go away in the summertime. We don't know if this particular new virus will have the same pattern, but here's a study that was published by a colleague of mine, Arnold Monto from the University of Michigan. He's in the College of Public Health up there, but he looked at 4 different coronaviruses that circulate in the human population and looked at when they actually caused infections in humans. And what you see is, the good news is, at least for those 4, they go away in May. They just really drop off the map in the month of May. But with those other coronaviruses, December, January, and February are months that we really need to worry about. I don't know if that's going to happen with the COVID-19 virus, but I'm going to talk about it at the end as we think about what precautions do we need to have in place as we approach the fall next year. Are we going to see another surge of COVID-19 cases? It's something important to think about. Well, this is called a novel virus, novel coronavirus, because none of us are immune to it. It turns out that it's spreading very rapidly around the world. I think you heard that we've hit more than 5 million cases in the world, and just spread very rapidly because nobody has any innate immunity. It's not like influenza where you've been exposed to the flu over the years, you've had flu shots over the years, you may have some innate immunity each year when a new flu virus comes around. Nobody's been exposed to this virus before, and so we have no innate immunity. The other thing that we don't know, which becomes really relevant moving forward, is if you get this infection and we do test you and you have antibodies, are you immune to the disease? Most experts think that you do have some immunity to the disease for some period of time, but we don't know how long. So it's really important to remember that. These are the symptoms that are commonly listed to think about. The ones that CDC promoted for a long time were cough, fever, and shortness of breath. And then recently they've added other symptoms that you should consider if you're going to do screening of your employees. Think about these other symptoms that are recommended that you screen for. So chills, muscle pain, sore throat, and then new loss of both smell and taste. If you have employees or know people that have those symptoms, they should consider the possibility of COVID-19. But on the next slide, I just want to highlight that there are a host of symptoms that occur in this particular disease. This is a large study of thousands of patients from China that basically showed there were a host of different symptoms that appeared at some course in the illness. In children, we see skin rashes. We also see GI symptoms like diarrhea, nausea, and things like that. So again, there's a host of symptoms out there. We tend to screen for the most common ones, but just recognize that this particular virus can present a lot of different ways. But I think one of the scary things that you need to remember is this point. 25 to 50% of the people with this virus have no symptoms, and yet they can spread the virus. They can spread the infection. That becomes really relevant. And honestly, I'm in conversations with many of the colleagues that I worked with at CDC about why are we promoting things like temperature taking and symptom screening. It may be okay, but I would just tell you, if you rely on those to keep COVID-19 out of your place of business, you're going to fail, because 25 to 50% of the patients who get this infection have no symptoms. And here's the proof. These are just some of the stories that are out there. There are lots of them now. Remember the Diamond Princess cruise, the cruise ship that couldn't dock? I don't know how many passengers there were on the ship, but 712 of those passengers tested positive for COVID-19. 46% of them had no symptoms when their test was positive. What about the aircraft carrier? Everybody heard about that one, USS Theodore Roosevelt, where there were 4,800 crew members, more than 800 sailors tested positive on that aircraft carrier. 60% when their test was positive had no symptoms. The ones that really scared me, though, was this one study that came out of 4 southern states where they tested most of the inmate population in their state. They had 3,200 prisoners that tested positive for the virus. 96% of them had no symptoms when they were tested. And then finally, another one that should scare us, particularly as we think about the elderly in long-term care settings and other places, a study of residents in a skilled nursing facility. Of those people who tested positive, about half had no symptoms. Asymptomatic spread of this disease is important. It's one of the reasons that we believe that the disease is spread rapidly throughout the world, and it's something you need to think about. And so my argument is to focus on concepts of universal precautions, because I believe you have to assume that potentially anybody that you encounter could have the infection. Well, what happens when you do get the infection? The good news is most people recover just fine. Of those who have a confirmed test, a positive test, we know that somewhere between 80 to 90% of those patients get to stay home. They don't need to be in the hospital. They have a flu-like illness. Now, I tell you, I've been in the home of a patient suffering from this disease, and it is not it is not a mild flu. These people are really sick, literally coughing their lungs up, high fever that may persist for days. They have to be considered infectious. So even those people who test positive but are minimally symptomatic may spread the virus, and you have to recognize that. But remember that there are certain populations who are particularly both at risk of the infection, but also at risk of the severe complications of the infection. The elderly, in particular, those that are over the age of 65, certainly patients with chronic illnesses like diabetes, lung disease, heart disease in particular, are at particular risk, and patients who are immunosuppressed. So cancer patients have a very high risk of this disease, particularly when they're on treatment, and they need to be protected. This becomes important for employers because you may well have people working in your business that fall into that high risk category. And I think we need to figure out ways to potentially accommodate those people. How does the disease spread? I think most of you have heard respiratory droplets. When you speak, cough, or sneeze, droplets come out of your mouth. You don't see them necessarily, you don't know it, but there's good evidence that droplets come out of your mouth. If you happen to have COVID-19, those droplets will be teeming with the virus, and somebody else can either inhale them, or those droplets can land on a hard surface. You touch that surface with your hand, and then you take your hand up and touch your eyes, nose, or mouth, and potentially get the infection. So we know that the principal mode of transmission of this virus is through droplet transmission. I read a very interesting paper this morning that looked at hotel rooms of pre-symptomatic patients, patients who were in a hotel who didn't have any symptoms, but then subsequently a few days later developed symptoms, and they found the virus heavily populating things like pillowcases, bed sheets, and things like that. So one of the messages from the paper was, tell your housekeeping staff not to shake things out and do things like that, because if somebody was infected, they may not have known they had symptoms, but the virus can rest on those surfaces. You've all heard about 6 feet of separation. I question the rationale for 6 feet, and I think 6 feet makes sense if somebody's not coughing or sneezing. And I'll talk about that in just a moment. But if somebody sneezes, we know those respiratory droplets can go up to 27 feet. Wow. And that's been studied. The picture you see on the slide comes from a study that was done at the Massachusetts Institute of Technology, doing photography of the respiratory droplets to demonstrate that they can spread a long way. So one of the things I'll talk about when you reopen businesses is making people hyper aware of people around them that have symptoms. So obviously if an employee is sick, you don't want them to come to work, but if they're at work and they see somebody else that's coughing or sneezing, they should go to somebody, a supervisor, somebody, and recommend that they potentially go home, because if you have somebody coughing or sneezing in the workplace, the virus can spread a great distance. So this is the study of sneezing. Here's a study of speaking. This is an interesting one. This was done at the University of Pennsylvania, where they did laser light photography of the droplets coming out of the mouth of a person who was just saying the term, stay healthy. And they had them say it louder and louder. The louder they spoke, the more droplets that came out. They didn't go very far, which is the good news. But definitely, even when you're just speaking, we know the droplets come out of your mouth. There was a large outbreak of COVID-19 in a church choir in Washington State, where a bunch of the choir members came together in a room and were just practicing, and somebody was infected in the room. The louder you speak, the louder you sing, more virus comes out of your mouth. So it's been well defined that droplets come out, and that's how you get infected. The other point I'll make about this particular study at the University of Pennsylvania, one of the things they did that I thought was very elegant, they just put a cloth over the person's mouth, and it virtually stopped the droplets from coming out, which has implications when we talk about masks. We know that most infections occur in the indoor setting. So restaurants, places of business, by far the most common place people get infected is from another family member in their home. But the virus definitely spreads in public places, and in particular indoor public places. So this particular slide shows an outbreak that occurred in a restaurant. And what they did was they showed that the flow of the air conditioning vent was shot across the ceiling from right to left, but then the return air went across the floor from left to right. They had a large number of people. A1, the person in yellow, was the index case that spread the virus, you can see, to many other patrons of that restaurant. So again, part of the reason that as you open things like restaurants, we're recommending that you socially distance, separate tables and things like that. And then finally, I talked about this on the news this morning. This was reported by CDC yesterday, but it came out of a study done by the Arkansas Department of Health, where a pastor and his wife became infected with COVID-19 in early March. They attended several church events. And then literally just a few days later, they started seeing outbreaks among the parishioners. And at the end of the day, that pastor and his wife were exposed to 92 people in the church, 33 of whom became infected with the virus. And then they followed those patients in the community, and 26 more people in the community that didn't attend the church but were exposed to some of the infected parishioners became infected. One person died. So again, the concept of public crowds bringing people in close proximity, if you happen to have somebody that's infected, and remember, half of them may not know that they're infected because they may be asymptomatic, you can see rapid transmission of the virus. I hope I'm not scaring anybody at this point.
No.
And then the last one, this was a fabulous case. It's the concept of the super spreader. Some people seem to be really good at spreading the virus. The problem is we don't know how to identify them up front, but they shed a lot of virus. They may be social people. They talk a lot, but they spread the virus. So this was a gentleman who lived in Chicago. He'd been out of state. He came back home. He was having some mild respiratory symptoms. He didn't think much about it, thought it was a cold or something like that. Went to a family friend's funeral. And in the funeral, had a meal with them and then attended the funeral, infected 3 different people at the funeral and 1 person who died. He then, 3 days after the funeral, attended a family birthday party. 9 attendees, 6 of those people became infected, but subsequently this one person spread the infection to 15 others, 3 of whom died as a, quote, super spreader. So there are some people, for some reason, it may be their immune system, but they shed a lot of virus and they can spread it fairly broadly. Well, one of the myths I've been trying to hopefully clear up to a certain extent on social media is this myth that this is just like the flu, or it's not as bad as the flu, or this is just, you know, a little bit worse than the flu. Now, tell me, when is the last time you saw hospitals anywhere in our country have to commission refrigerated trucks to hold bodies because of the number of deaths, or to run out of ventilators, or to set up ICUs and tents? It just hasn't happened with the flu. We haven't seen that since 1918. This disease is much, much worse than the flu. These people are very, very ill. I've personally seen them. They're very difficult to take care of. They can be very, very sick. Luckily, the majority do fine. But when they do get infected, some people don't do well. And in fact, this is data from the Oklahoma Department of Health, Oklahoma State Department of Health. In Oklahoma, confirmed cases of flu death in the state of Oklahoma. That is, the person had a positive test for the flu and they died. There are only 85 of those in Oklahoma this flu season. Just this year, since March 6th, we've had almost 300 Oklahomans who had a positive COVID-19 test who died. So most studies now are showing that the risk of death from COVID-19 is substantially more than influenza. Kind of the going number at this moment is that it's about 5 times higher mortality rate than influenza. That's assuming that there are a lot of people out there that got the infection that never got tested. We recognize that the hospital mortality rates reported today are inflated. We know that.
Hey, doctor, do you know on the in regards to the flu and how it compares to COVID-19, the majority, for instance, of those deaths, the 85 or so that you had there on the slide of the flu, were those also those in compromised categories, say you're elderly or underlying conditions? Do you have any idea about that?
So I don't know the characteristics of these 85 patients, but we know with influenza that influenza, interestingly, is a disease that is particularly severe in the very young and the very old. COVID-19, interestingly, much less of a problem in the very young. We see very few cases of severe disease in kids compared to influenza. But yes, we know for a fact that influenza, as another respiratory virus, has much worse outcomes in patients that are elderly who have underlying chronic medical illness. We know there are a lot more people in Oklahoma who died from the flu than just 85, but they're not tested. We don't know. It's not reportable in our state. So a number of these studies, this one that I highlighted here, was from New York, where they looked at confirmed cases of flu and confirmed cases of COVID-19, and they found that it was anywhere from 10 to 20 times more lethal than flu over the same time frame.
Thank you.
Well, here's where we're at in Oklahoma today. I graph this out every day. Right now, as of yesterday, we were at 5,532 cases in Oklahoma. We had 299 deaths, which is a death rate of confirmed cases of about 5.4%. Again, most of us strongly feel that we underestimate the total number of deaths due to COVID-19 because there are people who die in the community that never get tested. But we also know that there are a lot of people in the community who get the virus, who do fine, who have no symptoms, who never seek care and never get a test. So we don't know what the true incidence is in the population of Oklahoma. I put that same data, this is the same data from April 1st on a trend line, a straight trend line. This is not a curved trend line. This is nothing fancy. This is just a straight trend line. And what you see is we're not bending the curve much anymore. On average, in Oklahoma, on average, we're seeing about 100 new cases a day. And that's been fairly persistent since the 1st of April. We've just seen this kind of slow, steady rise. This number will never go down because this is cumulative cases. But what we would hope would happen is that the number of new cases per day would continue to drop and that we would see this curve start to flatten out and not go up as fast as it has been. The way I like to track the data best is using the 7-day running average or 7-day rolling average. So each day I take the number of new cases that are reported by the health department. I add to that the last 6 days divided by 7, and that's the number I record. It smooths out these daily, day-to-day spikes, which sometimes can be based on whether testing was occurring. We know on weekends, the reference laboratories may not get all the data to the state health department on time. So there are lots of reasons that the day-to-day number of cases spikes all over the place. But what we know in Oklahoma, and this is consistent with the way many public health reporting sites track this data, our biggest peak happened right around the first week of April. That's when we hit our peak, and we had a nice decline going in Oklahoma in new cases until May. And then the first week of May, we saw a pretty good spike, which the governor attributed, and many have attributed to the meat processing plant in Guyman, Oklahoma, where they had a large outbreak of COVID-19. We then started back down again, and then we've had another peak here just within the past week or so, which may be in part due to the outbreak in the county jail in Comanche County. It's not clear at this point, but we've seen a second peak of new cases in the month of May. And this is what's troubling to me. So I look at 14-day average. Remember, one of the President's Commission's recommendations on when you reopen your community is when you're seeing a steady decline in new cases for the past 14 days. And we were after the 1st of April until we got to May. And now if you look at the last 2 weeks, we're actually seeing a slow progressive increase in the number of daily cases. Again, right now we're somewhere right around 100 new cases on average over a 7-day rolling average per day in Oklahoma. So I think we need to be very cautious because the trend right at the moment is not in the direction we would prefer it to be. Here's testing. We're doing a lot more testing in the state. So the blue bars represent the number of tests that the state health department reported were done. There's always a big spike on Monday because the health department only produces this report 5 days a week. So the Monday report includes 3 days worth of testing. The good news is, I guess good news is that in mid-April, about 6 to 7% of the tests that were done were positive. We're doing more testing now. So right now we're at about 2.5 to 3.5% of the tests that are being done are positive. So that reflects that we're doing more testing. We're probably testing more people who aren't quite as sick. Remember, we've highly promoted that if you think you need to have a test, if you've been in contact, whether you have symptoms or not, go get tested. So we're going to find people who are positive, but they may not be nearly as sick. Because remember, early on, about the only people we could test were the people who were sick, who were in the hospital, the emergency room, and other places. Antibody testing was just reported by the state health department. This is the first report that they've given. Only 459 patients, and I've been told that they were mostly blood donors. 3.3% of the tests were positive for antibodies. What that's told me is if that number holds up, that's the approximate prevalence in the population of antibodies in Oklahoma, that 96% of the population is still susceptible to the infection. There are a lot of people who have not been infected yet, and we have to be very cautious because this virus can spread through a population quickly. Again, this data is very preliminary. We don't know exactly what percentage of Oklahomans are positive with antibodies. So this is my last of the public health slides, and then we'll talk about just a couple of points about reopening. This is something I use when I teach Introduction to Public Health on the Norman campus. And I talk about the iceberg effect of many diseases. We know that for many diseases, there are those people that are diagnosed and a whole lot of people that have the disease who aren't diagnosed. That certainly was true of HIV. When I first started seeing HIV patients, we saw the cases, but we didn't know about that large group of people below the surface that were infected but had no symptoms and then never sought a test. Probably similar with COVID-19. So as of yesterday, there were 299 deaths. Those are obvious. We count those. There were 5,233 confirmed cases, positive tests that hadn't died. Those people had clinical illness. But what we don't know is how big this population is below the surface. Those people who are undiagnosed, asymptomatic, or had minimal symptoms, never got a test done, we just don't know. People have estimated that this number is 10 times or so more than the people that have actually had a confirmed case. We just don't know what that number is yet. And that's the hope of antibody testing, to start to get some sense about what proportion of the population has potentially had the infection, but hasn't been diagnosed. I put this in here again. I'm going to highlight this again when we talk about reopening, but my message is consistent. You may know somebody, but if they've been out in public, they could have gotten infected. They may have no symptoms at all. You just kind of have to assume that anybody you encounter could potentially have the infection. So, what are some of the rules around reopening? Well, I think a couple of things I really highlight. One, we have to maintain social distancing. Ideally, separating workspaces, limiting the number of people that get into rooms. You know, we've all gotten used to Zoom meetings, so do we need to go back to meeting rooms where we pack people in? I think we can avoid that. Elevators, you know, how many people do you let get in an elevator? What about your break areas? Should you just close those or strictly limit the number of people that can be in a break room at any one time, recognizing that the hard surfaces in that break room could get contaminated. So then you need to have a regular schedule of disinfecting those surfaces. Is it possible to telework? Certainly, at least think about it for vulnerable people, older employees, people who have diabetes, heart disease, lung problems. Is there a way that they can work without being directly in contact with the public? Rotating schedules or doing staggered shifts. Enhanced cleaning and disinfection, I think it's really important. High-touch surfaces, everybody thinks about handrails, countertops, things like that. But do you think about copy machines, fax machines, printers, all the common stuff that we use, keyboards on computers, the stuff that we all use in the office setting that could potentially become contaminated. If you're in a retail business where you have touch screens for payment, there's somebody cleaning those routinely. And then personal responsibility, certainly promoting hand hygiene and making it easy to do hand hygiene with hand gel, sanitizer gel, readily available to employees and other things, and customers, that they can do it easily and routinely. I strongly promote wearing masks. I strongly promote mandatory policies of wearing masks in the indoor setting as a courtesy to protect those people around you. I'll talk more about that. And then there are lots of conversations about limiting non-essential travel. And just remember, you don't have to go very far to be in some hot spots. Dallas, Texas right now is having a substantial growth. Houston is starting to see a rebound in the number of new cases. You don't have to travel far to be in a hot spot and potentially in an area where you could be exposed to the virus. Here at the university, we have a strict travel policy. If you go out of state, you've got to notify and screen and wear a mask when you come back.
Do you have any idea on that, on the traveling, what the current recommendation is as far as how long that might last for travel, whether it be in the country or out of the country? You know, when do you think that might change?
You know, I don't know. I think we need to see a consistent drop in the number of new cases daily to the point where it appears that the virus spread is really slowed. And in the United States, we've seen that in a couple of areas of the country. So New York, it's not spreading nearly as rapidly as it was because of their very strict social distancing policies. But in other parts of the country, that's not the case yet. We're still seeing new cases. At the university, we're basically, we've banned any foreign travel at this point. Nobody can do it. Domestic travel, we don't have as much control over. But again, if anybody travels out of state when they return, they have to notify us. They have to go through a screening protocol. And if they've traveled to an area that's deemed to be at particular risk, they may be asked to stay home for 14 days before they can come back to work. So I don't know. I love air travel. I think air travel is actually much safer now than it used to be, because the airlines get it, that it's part of their lifeline now. If they don't show that they can limit the spread of this infection and keep you safe on an airplane, they know they're not going to get their business back. It kind of depends on where you're going. And then when you walk through the airport, you're exposed to a lot of people potentially. Right now you're not, but could be. So I don't know a good answer to that yet. I think what we will need to see is, as a country, sustained drops in the number of new cases or the presence of a vaccine.
Gotcha. And I want to encourage those that are tuning in right now, if you happen to have a question, feel free to drop that in the comment section of the Facebook Live, and I'd be happy to share that with Dr. Batzler.
Thanks. I want to talk about masks for just one moment. I divide masks into two categories. The one mask, the N95, that keeps droplets and particulates out. For the most part, those should be limited to healthcare workers. In fact, there was a study published today from Singapore that showed that the general public doesn't get N95s. They don't put them on right. Remember, in the hospital setting, we actually physically fit test those to the healthcare worker. So we don't fit test patients. We don't put patients in N95 masks. They're principally for healthcare workers, to protect the healthcare workers who, when I'm in clinic, I may be in the face of another person. So I wear an N95 when I'm in clinic seeing patients. But what I do recommend that the general population consider is wearing some type of mask, whether it's cloth, a surgical mask, to help keep the droplets that are coming out of your mouth from potentially going out and infecting other people. And if I were an employer, I would want patrons and other people who are coming in to wear a mask so that they can't infect my employees. I think it's very, very important. Again, that study from the University of Pennsylvania showed that a simple cloth over the mouth of a person would dramatically reduce those droplets from coming out. So I think it's really important. It's a courtesy. It's a sign of courtesy. It's not an infraction of your civil liberties. It's, because it may not protect you, but it protects the people that are around you. It's just a sign of courtesy to those that you work with or are around. And then,
do you see the wearing of mask as a new permanent normal, or next 3 or 4 months that it, might lessen a little bit? What do you think?
Well, I think I've already seen it lessen quite a bit, to be honest. I mean, if you go out, and I had to go to the grocery store the other day, and I wear a mask anytime I'm out of public, and I'm in a private office right now. But if I walk out in the hallway, I'll have a mask on. I think, in some cultures, as wearing masks has actually been part of the culture for a long time. And it's principally been done as a courtesy, as a recognition that other people around them are important. Because again, wearing a mask may not protect you, but it protects the people around you. You could be infected. You could have gotten exposed somewhere and not even know it and spread the infection. So that's why we encourage people to wear masks. There may be some benefit to you in reducing droplet inhalation. But again, the principal reason for wearing a mask is to keep those droplets that are coming out of your mouth from spreading. So that's why I recommend it. Some of you may have heard the news last night. One of the casinos had opened up. They had an optional policy for mask. Literally in their first week of operation, one of their security guards tested positive for COVID-19. One of the security guards that was actually doing the screening at the door, taking the temperatures, so potentially right close to patrons, they've now made mandatory mask a policy for that particular casino. I think a lot of the tribes are planning to make them mandatory. So that concept of, we know we're privileged to have you coming into our business, but we want to protect our employees. The other thing I always highlight about reopening is flexible sick leave policies. Encourage people. If you don't feel well, if you're not feeling well, don't come to work. Please don't come to work. And some companies have put into place kind of a COVID coordinator, somebody that any employee could go to and talk to and just say, hey, I saw, Jerry over there, and he's coughing a lot today. I'm not sure he should be here. And I think we just have to be open about that and recognize that we don't want people who are ill coming into the workplace. Again, I think, Scott, a lot of things may change when we have a vaccine that's effective in place. But until then, I think, the culture of mask and other things needs to live on, at least unless we see the virus just drop off like we saw SARS drop off 7 or 8 years ago.
What's the current best guess when it comes to a vaccine? What do you think?
Yeah, I'm going to talk about that vaccine. So there's good news that there are some that are in human clinical trials. Clinical trials take a while. You have to prove that the vaccine is safe. And sometimes, we're not going to know that for sure until millions of people have been vaccinated. Let's face it, vaccinating 8 people or 600 people is not going to give you that confidence that when we give it to 1 million people, that it's going to be safe. My experience working with a number of vaccine manufacturers in the past is that even when we get to clinical trials, ramping up the infrastructure to create millions of doses of vaccine to spread across this country is going to take a while. So I'm not holding my breath before sometime well into 2021 that we would have substantial numbers of vaccines ready to actually distribute, but that's just my opinion.
Gotcha.
I'm going to finish up with just kind of the back to the new normal. Remember, most infections occur indoors, homes, restaurants, meetings, businesses. Most outdoor activities actually are safe, much less likely to be infected in the outdoor setting, with the caveat that if you're outdoors and you're in a tight, packed, large crowd, then you could get the infection. Pool water, if the pool's properly maintained, is safe. It kills the virus. But again, you don't want to be in a pool with dozens of people tightly packed around you. If you're not feeling well, don't go to a public pool. And again, we've talked about travel a bit. remember the local hotspots. I think if people are going to Dallas, Houston, you just need to recognize, Amarillo in particular, just need to realize they're having real outbreaks of the disease in some of those communities. If you test positive, self-isolate. You need to self-isolate. If someone you know is positive, they need to self-isolate, and that includes isolating from their own family. So staying in a guest room, not using the same bathroom, things like that. When can you return to work? Well, in a healthcare setting, in our setting, if we have a nurse that tests positive, then we require that nurse to have 2 negative tests at least 24 hours apart before they can return to care. However, that may not be available to many people. So the CDC guidelines are, if you're completely asymptomatic, you had a test, it was positive, but you never had any symptoms, you have to wait 10 days after the test was done before you can come to work. If you were symptomatic, you need to have no fever for at least 3 days on no antipyretic medications like aspirin, acetaminophen, and there has to have been at least 10 days since the onset of the symptoms that you had before you return to work. Now, I will tell you, in our testing, both in patients and in healthcare workers, we're finding a few people that remain test positive for several weeks. We're not sure why, whether they're infectious or not, nobody knows, but we find some people that tend to carry the test positive for several weeks after the infection. But these are the current CDC guidelines on returning to work or getting back into circulation. Well, I wanted to end with just a little bit of good news, at least until yesterday it was good news. The number of, this is both persons under investigation and confirmed cases of COVID-19 had been steadily dropping. Since the 1st of April, we'd seen the steady drop in the number of hospitalization. Right now, we have plenty of hospital capacity in Oklahoma to take care of patients. So capacity at the moment is not an issue. I was contacted immediately by the press yesterday when there were 42 new cases reported by the state health department in one day yesterday that were in the hospital. Today, that number is down just a little bit, but again, there are a number of new cases. And in fact, if we just look at people who have a confirmed positive test, the trend over the last 3 days is bothersome. I don't like to call 3 days worth of data a trend, but I think we need to watch very, very carefully because we had this nice steady decline in the number of people in Oklahoma hospitals who had tested positive. And now over the past 3 days from the reports from the health department, that number has consistently gone up. So I think over the next few days to a week, we're going to have a good idea whether we're seeing some rebound in the number of cases. And we need to be very cautious at this point. I mentioned to Scott that this came out just yesterday, released by the CDC, which is their guidance on reopening businesses. Some of you may have seen that the Associated Press had a leaked copy of the original plan that the Trump administration didn't let get out. And quite honestly, I've read both of them, and there's not much difference in the new one that came out yesterday compared to the one that came out leaked earlier. This one, though, has a whole lot more activity and references related to testing, contact tracing and testing, which is typically pointed to state health departments and others that do that. So let me end by just a couple of key points. Don't forget, 25 to 50% of the people infected with the virus may be asymptomatic or have minimal symptoms. So we're doing lots of things. I've heard all sorts of recommendations to do temperatures in restaurants and things like that. And I'm very, ambivalent about whether it's going to be useful or not, because you're going to miss people. Don't rest assured. Don't get this false sense of security because you check the temperature and ask them about symptoms that you're going to keep COVID-19 out of your place of business. You won't. We know that. Remember that lots of respiratory viruses infect us by getting on our hands, by touching surfaces, and then putting our hands on our eyes, nose, or mouth. So that's one of the reasons that we really encourage people to wear a mask to keep those droplets from coming out and contaminating surfaces. Here are some of the complete unknowns. Is this virus seasonal? Are we going to see it keep dropping off here in the summer? we better be ready for fall and winter, because other coronaviruses, as I showed you, tend to peak in December, January, February. So we don't know. I hope we don't. I'd love to say we'd have a vaccine by then, but I'm not convinced that we will. We better be ready to do contact tracing. As I posted on social media not long ago, I said, we as a society are going to have to make a decision. Are we going to shut down the economy again? Just completely shut down, these broad brush apply to everybody, or are we going to do lots and lots of testing? If somebody's positive, we quarantine or isolate them. And we check their direct contacts. If one of those is positive, we quarantine them and check their direct contacts. I mean, really getting down into the details of detailed contact tracing and testing and isolation to contain the spread of the disease, rather than just broadly saying we have to close everything down again. I think we don't know yet. If this is seasonal, that could be a consideration in the future. Another one that's completely unknown: if you have a positive antibody test, what does it mean? We have no clue. We don't know if you've been infected or not. We don't know whether you're immune or not. So if we have a nurse that has a positive antibody test, and we are doing some studies with the state health department on our healthcare workers on antibody tests, we still make them wear personal protective equipment if they're in the healthcare setting. We don't give them any break because they have vaccine. And then how quickly will that vaccine be available? I think that's going to depend a whole lot on manufacturing capability to ramp up and produce a vaccine in a big hurry. Here's my email address. I always encourage and invite people to send questions if you have any. Really a pleasure to be here today, Scott, and I'll stop sharing my screen and turn it back over to you.
Okay, very good. Well, thank you. That's insightful information. And as you probably know, our local officials have been coordinating with Dr. Raskob, one of your colleagues, and in Norman, I'm proud to say, while trends certainly are somewhat similar to the rest of the state, we actually are trending down and have been for many days. I think some days we often have 0 new cases reported. Now, as you said, there's a lot of unknowns and a lot of people who they have no idea that they're infected. So I don't want to minimize that. But I also know that our hospital, as of today, has 0 positive cases in it, which is also good. I think some of that is attributable to certainly the policies that have been in place for the last month and a half, 2 months, and urging of people to wear masks, social distance, and stay home when absolutely possible. Do you have maybe some practical things that businesses might consider doing as they reopen, re-engage? What are you seeing that businesses are doing that are positive steps that they're taking?
Well, so I think many businesses have thought carefully about the safety of their employees, and they've thought about social distancing, separating desks, or putting up plexiglass barriers and things like that to stop some of that transmission of respiratory droplets. So I think some of those things are very, very useful. And again, they're detailed in that report of some of the things that you can consider to do. The other thing is, again, I'm a strong proponent of masks in public at the moment, because again, I wear one because I want to protect the people around me. I am a healthcare provider, and I'm sometimes in the face of patients. And so I've had no symptoms. I don't think I've been infected, but there's no way for me to know. There's a chance that I could get infected and have no. So I wear a mask to keep my droplets from getting on other people. I really support that. And then disinfection. I've read some reopening plans that have had very detailed instructions about how they have regularly scheduled disinfection plans and other things to really focus on protecting surfaces and think about, I was thinking about it, even in our office, we have a common copier, scanner, fax machine, printer. We all touch it daily. I question whether, how good are we doing at cleaning those common surfaces, but they're just everywhere in an office setting, and you have to think about that. I wanted to make a point that I'm very happy that Cleveland County is carefully watching the number of cases. That's really important. I do want to highlight one thing that this virus got here from China. It spread because people travel. People travel in Oklahoma too. And even though we've got an outbreak in Lawton and Guyman, and who knows where else, those people don't necessarily just stay in Guyman or Lawton, and people in Oklahoma City may go to those communities. And so we just have to remember that just because we have an outbreak in one part of the state doesn't mean we can contain it there unless we're very, very, very strict about contact tracing and isolation. And the one thing that caught my attention last night when I was watching the news and they were talking about the casino is they were interviewing some of the patrons, and some of them had traveled long distances to go to that casino because they wanted to go to a casino.
I was reading an article yesterday and talked about technology in businesses, and the author of the column was suggesting that he's surprised that restaurants are still handing out menus that you're not using. You should go ahead and start using your phone and just look at your menu there. It doesn't make any sense that the restaurant will bring to you the credit card holder and all the exchanges of a receipt and a credit card and things. And so I suspect that technology is going to continue to move rapidly to address some of the needs around the pandemic.
Yeah, I think you're right. All the touchless technologies that potentially could protect patrons and protect the employees that work in those businesses, I think it's very, very important.
I had a question from one of our viewers that I'd like to get your thoughts on. They ask, what are your concerns over people not keeping their masks cleaned or sanitized regularly, or wearing them if they're not wearing them correctly?
Yeah, so it's a good question. We are using a lot of cloth masks in our health system now. We put all visitors, we put all patients that come in some type of a cloth mask, and we have a regular cleaning schedule. If they leave them, they're all clean and sent through a disinfection process through the hospital laundry. So the principal thing about wearing a mask that somebody hasn't washed and things like that is that they actually put themselves at some risk, because you're absolutely right. If I wear a surgical mask for any period of time, the inside will become moist, and that's a great place to grow bacteria and other things. I'm wearing the mask primarily to stop the droplets from coming out of my mouth. It does that, but that mask does become damp. And so it potentially has an influence on my health if I keep wearing that mask that could be contaminated. Certainly in the healthcare setting, we worry about the outside of the mask too becoming contaminated. And so we teach the healthcare workers how to put on and take off masks very carefully so that they don't contaminate their hands when they do that. And then of course, we recommend people all the time to remember hand hygiene. The other thing is some employees need to wear gloves once in a while, particularly if they have direct contact, if they're touching patrons, if they're doing part of the cleaning protocol when you're cleaning those hard surfaces. You need to remember to do hand hygiene before you put your gloves on, but also when you take the gloves off. Again, you can get this false sense of security that the gloves are going to protect you, but you can contaminate gloves and touch your eye just as easily.
Good. Well, Dr. Batzler, we certainly appreciate your time and your wisdom in talking about the Norman Chamber of Commerce. We're going to get through this together. These are challenging times. But there's a lot of smart people out there who are working, whether it be on best practices or the vaccine. We're going to manage this, I realize. And I want to remind those that are watching this that Dr. mentioned that CDC policy, and on our website, normanchamber.com, we have a link to the CDC, so you can go there and get those guidances, and we encourage you to do that so that your family and your business can operate in a smart and safe way. Well, Doctor, thanks again for your time. We really appreciate it, and we appreciate you engaging with Norman Chamber of Commerce today. And for those that tuned in, thank you for joining us. Stay tuned for our next COVID conversation. Until then, be well and healthy, and we hope to see you soon. Thanks.
Thank you. Thank you.